and welcome to the first edition of 2024 of our traditional webinar, Ask Julie Anything. I think now that you know this already, but I am Mariana Nadai, Marketing and Events Coordinator at Adore Bees, and I will be your host today. And during this session, our founder and formulator, Julianne Lee, will answer... we'll answer all your questions about the health and well-being of your beloved fur family, our products, and much more. So don't be shy and ask Julie anything. But before we start, I want to ask for you all to switch your chat to everyone so that we can all join in on the conversation. And please use the Q&A box at the bottom of your Zoom screen to ask your questions. We will do our best to get through all of them. I also want to remind you that this session provides a judgment-free space with only the health and happiness of our animals and the planet being our core goal. So without further ado, I would like to invite you, Julie, to start talking. And I don't know if you have like a few words to say to our audience today, since it's the first webinar of this year. And I don't know if you have any...
Oh, that's crazy, eh? It is the first webinar of the year.
Yeah.
I never even thought about that. Well, hi everybody. Welcome. We brought the first webinar of the year in with a bang here. We had this massive storm. So that always is like difficult on a rescue farm, keeping everybody safe. Trying to figure out from 1 minute it's snowing and then the next minute it's raining and then it's like 100-kilometer winds. And so today's been a pretty intense day and everything's calmer now. It's still like 54-kilometer winds. So, but sometimes when you live on the ocean, that's calm. So I think that I was texting someone today. They sent me a text saying, "Are you guys safe? Is everything okay? It's been pretty intense." And I said, yeah, everybody's fine. And it's just, for me, it's just like after a storm, it's there's this space where you just kind of can breathe again and relax a little bit and know that everybody's okay and safe and, you know, chewing on hay and whatever they're doing down there. And it kind of reminds me of the anxiety that I saw a lot with my clients at my clinic, right? Like, you know, feeling like the unknown, like you don't know what's going to happen in a storm. You don't know whether, you know, the winds change and is the barn going to flood and is this going to happen? Is that going to happen? And really the anxiety is just, it's not about the storm. It's just about keeping our animals safe, right? And it reminded me, I was texting him tonight and I said, you know, it's incredible how for, you know, 25 years, I would say to people, don't worry, you know, we'll sort it out. We're going to figure it out. You know, I know it's an anxious time for you, like from skin disease to cancer to pregnancy to whatever, dental, like having dental surgery. Our level of anxiety gets really triggered when it's around our pets and our health, because we feel so responsible for them, right? Like we feel fully responsible, and in a way we are. So I'm really hoping that, you know, these lectures, and first of all, I want to say, if anyone is anxious about their animals or has ever been in a place where they're anxious, it doesn't matter how much training you have. It doesn't matter, you know, I mean, I've been doing this for a really, really long time, and I feel like I have a lot of tools in my toolbox, and I feel like, you know, I'm very confident to navigate things, but I still have it, right? I still have, am I making the right choice? Is this the right decision? You know, what could go wrong? So I think when I was saying to him, is I said, it's incredible, no matter how much you're in this and how many years, when something happens, you know, because you can't talk to them and you can't explain to them how that anxiety comes up. So I think part of navigating our animals' health is really learning to stay grounded, right? Like really, really trying to, center ourselves and be present. And part of that comes with, creating philosophies and structures and decisions that you want to make and would make and don't want to make prior to them being sick. So, today when we're going through questions, I think it might be cool, Mariana, to talk about, you know, how would you navigate this? Like, let's say we'll look at the questions and I'll see if I can even do it.
Mm-hmm.
How could we be maybe more proactive with the approach? Okay, here now we have the disease or the whatever's going on, and then how do we kind of like make a decision moving forward of how we're going to continue to treat them or work with them, right? Because I think when you do that, it really helps you feel more supported and more empowered. So I thought maybe that would be interesting today to do too. And see if I can look at some of that and maybe so that if there's people that don't have the problem that the questions are about, but could definitely have the potential of having them, right? So
Mm-hmm.
how do we sort of like not only try and alleviate it, but how do we try to prevent it from even happening? Okay.
Of course. So let's start it. So Bridget is asking, my dog tested positive for Lyme on December 20th, and she's 9, and I brought her in for a senior blood work, all perfect, including kidneys, because she's a bit weak in the back end. Big rescue dog, spayed early, and has been flat on the floor 4 times in the past year. The vet considers her symptomatic and prescribed
Doxycycline.
doxycycline. Dr. Evans is a friend, and together we have resolved these episodes with various homeopathic remedies. Twice it happened after an hour of swimming in the ocean. She's used to the warmer Pacific, so there is some correlation. The complicated matters, she has been seeing an animal chiropractor for 2 years due to what presents as floating lameness. But she had a negative Lyme test the last 2 years in a row, and there is always a corresponding chiropractic adjustment to make. I understand that lameness
Yeah.
lameness is due to the
Spirochetes.
spirochetes eating away at the collagen in the joints. All that to say is the
Technical.
technical symptomatic. The vet told me she could die within days if I don't put her on doxy, so I gave it.
She could die within days. Bridget, can you, Marianne, how do we do that if I ask questions that she can either put it in the chat maybe?
Yeah,
The
she
answer in the
can.
chat?
Let me see here. There's another option.
So Bridget, can you just type that in the chat that you can hear me asking you questions?
Oh, she said that there's a part 2.
Oh.
Okay,
there's
part
a part
2. Yeah.
Where is it? Bridget.
Okay, so the vet told me she could die within days if I don't put her on doxy, so I gave it to her for 1 day, and then came across a lot of research and opinions that is not the best approach, that I can temporarily lower the numbers, but it also knocks back the immune system. Question 1. In your opinion, should I give the doxys there ever a time that you would go straight to antibiotics? 2. I understand that both doxy and ledum kills the spirochetes and
Yep.
in a petri dish. I gave her Lidun 1 m 3 times a day for 3 days, 10 days after she tested positive on December 20th. They didn't offer QC6, and I had to wait until January 2nd for that. Her number was 127. QC6 was done 10 days after we finished the Lidun protocol. Should the numbers then be lower in 6 months when I retest? And the third question is, I have researched herbs that can keep Lyme at bay or ease symptoms. One is cat's claw, with conflicting advice since apparently it can be hard on the kidneys. Do you have an opinion on this, as I imagine I should be supporting the kidneys?
Well,
That's a lot.
I know I have a really big opinion on Lyme because I had it myself personally.
Mhm.
So I've researched Lyme out the yin yang. You know, I was misdiagnosed with it for like almost 2 years. And so my understanding of Lyme, and I'm going to just say this from my personal experience and working with animals and stuff. I still my question was, and maybe she can put this in the chat. My question is why did the vet say she could die any day? Like what was her reasoning that she said she could die any day? I guess I'm a little confused about that. Like it sounds like she's, having she's had 4 episodes in a year of collapse, I guess. But is she doing Lyme dogs can die from yeah, I know, but her kidney values are normal, right? Isn't that what you said, that her kidney values were normal? Okay. So, I'm definitely not going to go against the vet. And I know lots of animals that have gone on doxycycline, and I know lots of people that have gone on doxycycline, and I know, but my understanding about Lyme is that doxycycline basically only works in the first acute phase when they first get it. And once they have sort of embedded or gone into the cells, spirochete like takes up shop in the body, they are ebbing and flowing with the health and the situation of each person and each animal. So by giving doxycycline when it's chronic, right? When it like not, I've heard that doxycycline can work really, really well, I think within the first 5 days of being bitten. And then it can work. It can just like sort of kick it in its butt at that time. But if you're using doxycycline when they're chronic and they've had it for years, then what will happen, or what can tend to happen, is exactly what you said, that doxycycline will compromise the immune system. And that is what has to stay like fastidious with Lyme, is that, people and animals can live completely normal with Lyme disease forever if the immune system is strong enough to keep the Lyme always at bay. And she said she tested negative a year ago. I'm not a big fan of the tests, because I feel like the actual being of the Lyme, the way Lyme lives in the body, I don't really honestly feel that chronic testing is an accurate method of knowing when to treat, when not to treat, how not to treat. For me, you kind of have to chase Lyme like symptomatically. If the dog is energetic and healthy in eating and clear eyes and a good skin coat and is vital, like you can just tell your dog's healthy, then whatever you're doing is right. So I have, you know, I went actually on for myself. I was treated with all different kinds of herbs. I think that uh there's lots and lots of different herbs that are really good for Lyme, like Japanese knotwood. And what I would do is I would reach out to Rita Hogan, and just ask Rita about Japanese knotwood and the different kinds of herbs for Lyme, and then maybe ask her if she could do a consult with you and create a tincture for you. And then each lameness issue was treated successfully with homeopathics. Yes. And I think um I actually think Dr. Evans and I talked about Lyme not that long ago too. I think he had a bunch of patients um with it. And I think that, you know, him and I are very much on the same page when it comes to stuff like that. And homeopathics like Ledum, like phos acid, like you know, the different kinds of weakness, joint weakness, periosteum pain. Um, but Lyme in general, what I'm trying to do is the higher level look of Lyme, in my perspective, is keeping adrenals really healthy, stress levels as low as possible, eating as well as you can, as you can feed your dog, reducing things like sugars, using lots of really potent antioxidants. Like for me, my routine when I got sick is I take phytoplankton 3 times a day. I take our phytosynergy 3 times a day, and I take turkey tail and liver tonic 3 times a day, no matter where I am, where I'm flying, if I'm away. Those are the things that are in my bag all the time, and I take them all the time. And then if I'm feeling tired and I'm starting to feel like maybe, you know, there's a possibility, then I treat myself acutely. So if I start getting, uh, he asked you for me. Yeah, I thought that was you, that he was talking to me. Um, so, you know, like if my hands are feeling a bit stiff, I'll take some Rust Tox. So if you see your dog's symptomatology, like being affected, then you can treat your dog based on what you're seeing, because it really won't matter, because homeopathic remedies go to the core issue of the problem. So you're not suppressing it, you're not band-aiding it, you're not doing anything like that. You're like, okay, my dog is looking weak, so I'm going to give my dog China and phosphoric acid. Well, that China is really good actually for Lyme, because it treats things like um waterborne illnesses and protozoas and things like that. So if you're seeing weakness, if you're seeing phosphoric acid in China, uh regular phosphorus is actually really good for Lyme, because it's really supportive of weakness and also of the kidneys. But giving things like liver tonic that have berberis in it and liver or kidney support, like constant kidney support, to just make sure that the whole portal system is working optimally, that's really important too. That's why I take it every single salt. I take liver tonic 3 times a day, no matter what. So you just need to allow the body to be able to work with Lyme kind of in its own way. And I've seen lots of animals go on doxycycline that have chronic, and people that have chronic Lyme, and they get sicker because it destroys the microbiome in the gut. It reduces their ability for their immune system to stay really functioning. I don't know. I can't tell you not to do it. That's for sure. I would listen to Dr. Evans. I trust him completely on whether or not you should go on the doxy. But I think that there's so much more that you can do. Like I said, talk to Rita. Oh, and the other thing is And like I said, turkey tail, phytosynergy, rotating probiotics and prebiotics, really good diet, liver tonic, and really, really not, I don't know, more than what we probably put on our containers. So instead of giving him it once a day, I would give it to them, not the probiotics, but I would give phytosynergy, liver tonic, and turkey tail 3 times a day. I wouldn't just do it. I wouldn't just do it once a day. I would really, really boost this immune system in comparison to a dog that has an autoimmune disease, right? You don't want to boost, you don't want to like ramp up the immune system with an autoimmune disease. Particularly, you want to balance it and try to make it as modulated as possible. But with Lyme, you want a rockin' immune system. You want it really, really, really as strong as you possibly can. And, things that support hormones. And, she's a large dog. She was spayed. I would reach out to Andrea Ring and see if you can get her spay and neuter protocol. And I would put her on those homeopathic sex hormones to support her hormone function. There is so much you can do for Lyme that it's out where I live in you must live in Halifax if you're, or Nova Scotia. But the naturopath, the doctor that I went to when I had it, they joke and they say who in Nova Scotia doesn't have Lyme? Like it just goes misdiagnosed. They diagnosed me with depression and anxiety. And I kept saying, I have Lyme. I know I have Lyme. And they kept saying, no, you don't. No, you don't. You just have depression and anxiety, and wanted to put me on drugs. And then finally, Karen Becker said to me, okay, this is ridiculous. Take this test to your naturopath and have them send it. It was in California. And I took it to them and they drew my blood and they sent it, and I had 4 different kinds. So I was lucky, and I couldn't even walk. I could hardly get out of bed. I couldn't do anything. And I was really sick and really scared, and I lost like so much weight. It was insane. I think I weighed like 112 pounds. And I was scared and I was super anxious, but I feel amazing now, touch wood. And in fact, you know what? I think of it as a blessing because I have because I had it or have it still. I use it as my self-care tool. So if I start like burning the candle too much and I'm like eating crappy food and I do that and I get a little bit of a tweak thinking, oh, it scares me so much that I smarten up. I don't let myself go crashing down in that cesspool of, okay, now I'm going to get all my Lyme symptoms back. It's too, so I kind of feel like that I use Lyme as my guide to know what to do. So don't I'm not gonna say don't worry about your dog, but there's tons and tons and tons of stuff that you can do for Lyme. I can't say don't be scared that she's gonna drop dead. Like, I can't guarantee that, but your vet can't guarantee that either. But that she's not gonna get worse on doxycycline. So I would talk to Dr. Evans, and I would just boost her immune system and treat her acutely with homeopathy as you see the symptoms come up. And that's, I know I took a while to talk about this, but there's a lot of animals with Lyme. There's a ton of animals with Lyme, and it's getting worse. And I think the reason it's getting worse is because um we're using so much tick medication that I actually feel like the ticks are actually getting stronger. Because even though we're giving, all of this topical tick stuff, they're still getting Lyme. Animals are still coming down with it, right? They're still getting bitten and then getting it. So I think we might be making a stronger, uh, the ticks are just getting stronger, or the virus is just getting stronger, or, the whole disease is just getting less resistant, or more resistant, I should say, to all the drugs. So yeah, that's what I would do.
Thanks, Julie.
And you know, we talked about being preventative.
Mm-hmm.
The best way to prevent Lyme is to make sure that your animal's immune system is really, really strong, like as strong as you possibly can get it. And then they can get bitten and not become symptomatic, you know, like ever, even sometimes, you know?
Mm-hmm.
Yeah.
Great. Beth is asking here, her 5.5-year-old male cat started not finishing his raw food completely, very picky, will eat my food, some goat's milk, green juju, salmon treats, urinates at least 3 times a day, has lost 2 pounds. Also, only poops once a week, blood work, creatinine 3.3, as DMA is 21, normal is 0 to 14. No other values are elevated. Thyroid is normal, did not have urine analysis. Started giving liver tonic, love bug, but not sure if he's getting all of it. What else could you suggest?
He will eat his food. So this is where I kind of allow animals to dictate what they're really needing. And when you said it's not finishing his raw food completely, very picky and will eat my food. Opie, where'd it go?
It's the first one.
Oh, there it is. Just kind of moved. Um, um, and lost weight. I mean, you know, being picky, losing weight, only poops once a week. Those are definitely all sign of renal disease. Those are all symptomatic of renal disease. So I would say that, you know, different vets have different philosophies on things. If he's only pooping once a week and he's starting to lose weight and he's getting picky with his food, I would go to your veterinarian and ask if you can learn how to do subcutaneous fluids and start subcutaneous fluids once a week. Just to start and see if if he poops better, see if he starts pooping better and eating better. Those would be two ways of knowing if the fluids are helping, is those two symptoms. The other thing is that I've worked with a lot of cats with renal failure, and I put them, if they don't want to eat their raw, I don't give them their raw. I give them cooked food, like cooked chicken predominantly. So you want to have you want to have meat that's easy to digest protein, right? So because what will happen if if he doesn't finish his food and he stops eating, then he's going to, that protein level is going to go down, right? And cats need protein, whether they have kidney failure or they don't have kidney failure. When we hear about low protein food, it's, to me, I've never seen it be successful because they still need the same amount of protein. The body doesn't go, oh, I've got kidney failure, so now because I'm a cat, I've got kidney failure, so I'm not going to need the amount of protein. They still need the amount of protein, so they start to ingest their own muscle mass, and they start losing weight because they're literally eating their own protein. So it's really important that he eats. So I would start incorporating some cooked chicken to his food so that to be sure that he's getting the correct caloric intake so that he's not actually ingesting his own muscle mass. And I would talk to your vet about starting some subcutaneous fluids and definitely continue the liver tonic. You could try, if he's not like in love with love bug, you could potentially try soil and sea, because uh if they like fish, and lots of cats do, then sometimes they really like soil and sea. I would start phytoplankton with him too, so phytosynergy as well, and homeopathic phosphorus, like a 30C phosphorus once a day is incredibly helpful, or 12C or 30C phosphorus. It is really, really helpful for kidney disease as well. So that's what I would do. I would look at incorporating some cooked meat. Ask your vet if you can do subcutaneous fluids once a week. Once you start subcutaneous fluid once a week, see if his intake of food is better and if he starts to poop more often and stops losing weight. And that should help too if he's eating his normal amount of food. And do phytosynergy. I would do liver tonic if you can twice a day. And you could try and see if he likes or the other one you could try is, well, that might be very helpful, is the feline gut soothe or Felix Flora, because it's got Felix Flora might be even better because of the cat probiotic, right? The cat bacteria in it. And just play around with them, and by alternating the probiotics, you might see if he likes one better than the other. But there's lots you can do with kidney failure, and for me, subcutaneous fluids is a big one, and phosphorus is a really, really big one as a maintenance thing to try to stop it from getting worse and worse. So that's what I would do. Oh, that's the other thing too, is try to get some urine. I don't know if he's peeing normally. He urinates 3 times a day. So if you can go to the vets and get some Nosorb and take 1 litter box and put Nosorb in that litter box, and then collect the urine, take it to the vets and see what his specific gravity is. That's important. Try to do it in the morning. So that will tell you a lot about his kidneys, and then you don't have to keep going and taking them in. You can just do routine urinalysis through this Nosorb thing, because if he's not concentrating his urine, or if he continues to concentrate his urine, or all of a sudden his concentration of urine goes up a little bit, then you know that you're on the right track, and it's non-invasive, and you don't have to take him to the clinic, and it's not as expensive. So I would also do that.
Amazing. Thank you, Julie. So this is a question from Carol and Jim Duff. Hello, Julie. What supplements and homeopathic remedies might you recommend for our 15-year-old Tibetan Tibetan Terrier with advanced cataracts and dementia? We have him on your phytosynergy, also CBD Heal and Vitality Mushroom Blend from CBD Dog Health Angela Ardolino for his mast cell cancer. We have rotated him through all of your probiotics as well. We are thinking about giving him Phytosflora again. Thank you.
So cataracts and dementia. Okay. So coenzyme Q10 is really good for all of that stuff. And sometimes my first thing is that if he's got, maybe can we find out, have you had blood work done on him lately? Just a question. Maybe they can put it in the chat, Mariana. I gotta turn up.
Let me see if they're here.
Because just wondering if you've had blood work done, not lately. So I know it's terrible to have to take them in, but sometimes when I hear cataracts and I hear dementia, sometimes I get a little worried about high blood pressure. And, is it like, and also diabetes. I don't know whether or not your pup is drinking a lot or peeing a lot, but diabetes, high blood pressure, cataracts, and canine cognitive disorder can all kind of look similar, and they can all be very, very related, right? I'm not saying that he has any of those things, but it wouldn't hurt just to go in and have a jerry panel done, just to be sure that you're not dealing with something else. Doesn't mean you have to go on drugs. It just means that then you can be more specific about what you want to do naturally to support him. So things like our wolf strain probiotic, I think, has a real affinity with the gut brain axis. So that would be a probiotic that I would seriously think about putting him on. The other thing is lion's mane. Lion's mane for brain function is really, really good. Lion's mane mushroom. Now, cataracts, there's homeopathic remedies for cataracts, like silica, belladonna. There's all different types of homeopathics for cataracts. Thiocyanium. What you could do is you could actually get a remedy called gut seal, which is a homeopathic remedy, and it would definitely help with his gut, but it also has thiocyanium in it. You could definitely put him on that. But I would get some blood work done just to be sure that oh, he's on phytoflora. So is he on phytosynergy or phytoflora? Can someone put that? Because you've got like PHYTO. So is he on, or you're thinking of giving him phytoflora?
Phytoflora.
Where does it say that?
Oh no, that's what I got from reading.
Yeah, but it's spelled.
Phytoflora.
Yeah, so I'm wondering if he means phytosynergy or does he mean
He's in
phytoflora?
phytosynergy now.
Synergy.
Yeah.
Okay. You're giving him phytosynergy. You're thinking of giving him phytosynergy again. Absolutely. Without a doubt. Because the more superoxide dismutase, the more antioxidant, the more oxidative, like supporting oxidative stress for cataracts is really good, and for brain function. Did you also say he had for mast cell? That's really interesting. Well, that would be my, I would put him on gut seal, homeopathic from us. I would definitely put him on phytosynergy. I would support, I would go get some lion's mane. You could look at some coenzyme Q10, but I don't think I would do even coenzyme Q10 until I got blood work done. Make sure that he doesn't have diabetes, make sure that he doesn't have high blood pressure. When you go with the vet, having them check his blood pressure. And then antioxidants and the gut brain axis with the wolf strain. I would definitely put him on the wolf strain and see how it goes. But cataracts are hard to, once they're there, they're really hard to, but they don't just get cataracts just because they're old usually, right? Like cataracts happen for a reason. And I'm, I just don't want you to be going, oh yes, it's dementia, but meanwhile he's got like high blood pressure and he's pacing or bumping into things and can't see things and he's getting cataracts from that. So I would definitely for sure try that. And just so that you know what's going on with him. And then when you find out, you can reach out to us once you get some blood work back, and we can even be more specific about products that you might want to try. I just worry when I see those, my little alarm bells go off to just be 100% sure.
Thanks, Julie. Amanda is asking here, my male beagle has developed brown pigment on the whites of his eyes along with sclerosis. Our vet said that since the spots aren't raised, it shouldn't be a problem. One area has a spot that is getting bigger, so we schedule an ophthalmologist appointment for tomorrow. There are several puzzling symptoms we are working with internal medicine to figure out. We believe there is some kind of inflammation going on. Do you know what some causes of brown pigmentation on the eyes could be, or what questions should I ask the ophthalmologist tomorrow? P.S. The pigmentation on his stomach has faded significantly since using liver tonic, which is very interesting.
Okay. Well, any kind of sclerosis or any kind of pigmentation, things like that, my first go-to with anything like that is immune modulation. Really, really try, because it could be a type of hereditary eye issue. There's a lot, like especially the sclerotic part of it. You want to make sure that, oh, you know what? Sorry, guys. Sorry. The woman that has the dog with Lyme disease, I totally forgot this, is I would be giving your dog collagen. Sorry. I just went to that right now because I was going to say with eyes, collagen is a big one. Collagen is a very, very big supportive supplement to give for eyes. And just questions to ask is it always risk versus benefits. Find out, ask for the physiology, try to understand, like if instead of just getting a diagnosis like scleroderma or whatever, ask what is the process. So I always think that people should understand not just the term, the name of the, this is a glass, but what does that glass do? How was that glass formed? What are the organs that are the causation of that glass, or what organs support that disease from getting better or getting worse? That's always how I look at medicine in general, is looking. I actually taught at the American Holistic Veterinary Medical Association. I taught looking at homeopathy and physiology, because I feel like if we understand the physiology of the disease, we can be super specific with either homeopathy or herbs or specific mushrooms or specific kinds of antioxidants. It's really helpful. So the question that I would ask when you go to the ophthalmologist tomorrow is, what do they think it is? What's the prognosis? What is the treatment? What are the side effects of the treatment? What, if they say, if you don't do this, this could get worse. Well, what percentage, how quickly? Get as much, really get as much information as you possibly can. It's amazing when you have that kind of information, how you can really narrow down, really hyper focus with specific homeopathic remedies and herbs and even probiotics and prebiotics. So, but in general, for eyes, coenzyme is Q10 is good. Pigmentation, it's so interesting. Thiocyanium, like what we were talking about with the cataracts, thiocyanium for any kind of pigmentation or scarring, sclerosis. The reason that I made gut seal is, and why I said thiocyanium, that's in gut seal, is because when the gut starts to heal, so here we have leaky gut. So we're like this. So the leaky gut protocol, our hope is that we increase the epithelial cells, we decrease the inflammation, and we support the junctions to get tight again, right? The problem is that when they get tight again, they can be thickened. So you look at inflammatory bowel disease and you look at thickened gut wall lining, where it might be a tight junction again, but that tight junction can be thickened. And if it's a thickened tight junction, then the micronutrients and the bioavailability and the digestibility of food in that gut is less. So my focus is always that when we are trying to heal the gut, we are also trying to decrease scar tissue in the gut from the trauma. And thiocyaninium, that's their is I can I have to find out how to spell it exactly. Thiocyaninum is actually where it's actually called. It's THIOS. And then I think it's INUMIN. Someone will have to look it up. Emily, you're out there. Can you? Oh, there it is. Callan did it. Thanks, Callan. So that's what it is, but it's actually in our gut seal, and it's a really hard remedy to find. And what else is in our gut seal is arnica. So it also helps for the inflammatory process of sclerosis and stuff. So you could definitely start them on that until you figure out what's going on. Liver tonic, I would stay on it because anything that has pigmentation, you want to make sure that the liver is functioning correctly. And yeah, that's what I would do. Just go and find out. But when I look at sclerosis, I think aging, right? So what helps with aging? Collagen, and oxidative stress, things that stop oxidative stress, like SOD, so superoxide dismutase from our phytoplankton, supporting the liver, a lot of really, really important gut probiotics. So for your puppy, you have this beagle, I would rotate all of our probiotics. Every single one of our probiotics, I would rotate. And then omega-3s, so our potency would be really, really good. And it's also really good for brain development. So the person also that had the dog with the cataracts and the possible dementia, omegas and DHAs are really, really good for brain health. Yeah, and then go and then try to narrow down what it is and then go from there.
Amazing, thank you. Christina Higgs is asking, hi, Julie, have you ever come across a dog that just doesn't like to drink? My GRT has refused to drink any liquids, especially water, since I rescued her at 12 weeks old. The only exception being rarely drinking after playing. She's now 10, and I have tried so many things, even bone broth, with no luck. Her taste buds want the flavor so bad, but it's almost as if she doesn't like the sensation of drinking. She will take a few laps of it, then will shy away and not touch it again. I'm so puzzled by this because she loves yogurt. I was making progress with her where she would drink the water I rehydrated her freeze-dried raw with, but she is suddenly refusing all liquid again. I haven't been able to figure out what triggered this relapse. She's only been on raw about 2 years now. Just waiting to ask it if you have any wisdom to share. Is there any homeopathics that might help her? Thank you so much for your time and shared wisdom.
And she's been like that since she's been 12 years old, 12 weeks
12
old,
weeks old.
12 weeks old, and she's 10 years old now.
So
Well,
for 10 years, she's like that.
yeah.
She was always like that, maybe.
If she has blood work and she is healthy, honestly, it could just be an emotional aversion to it. Maybe she's getting enough fluid from her raw food, right? Her raw food or her dehydrated raw food, whatever you give her. But it is odd that she doesn't want to drink anything. But I don't know, thirstlessness, there's lots of homeopathics for things that are thirstless. But there's got to be more than that. Like, I wonder, a question I would have is, does she pant? Like, is she able to I think someone said put bone broth in her water bowl. I mean, I think that you were trying to give her bone broth, right? And she drinks it, and then she doesn't even want to drink the bone broth. So no, she doesn't pant. So two things if she doesn't pant. One is she just a dog that isn't hot, that doesn't get hot unless she's hot or stressed? Okay. So can she pant? Can she stick her tongue out? Is basically what, but very rare. Does she kiss you? Is she able to lick you? Does she? Oh yeah, absolutely. Yes, she can. So, because that would be the only thing that I would be worried about, is that there's something wrong with her, her tongue, where she can't lap, or it bothers her, or it affects her, or affects her throat in some way. But if she can pant without any issue, and she can stick her tongue out, and she can lick you and kiss you and things like that, then I don't think it's that. It's got to just be an aversion, and she doesn't really need it, because you would think that if she needed it, she would drink it. You know, I honestly don't know. I wish I could give you some more wisdom, but you know, it never hurts to have I mean, I know I'm talking lots about blood work, but that's because I really like using blood work as a tool. If you look at her, take a urine test in the morning, first thing in the morning, that's going to show you so much. If her urine is like insanely concentrated, then she's not drinking enough. Her kidneys aren't processing water enough. If she's got an insanely high concentration of urine. If her urine is normal, then her kidneys are functioning better, right? And or not better, they're functioning, they're okay. And then you can always take some blood work and see if she's dehydrated, right? What's her hemoglobin doing? What's her red blood cells doing? You'll be able to get a little bit of peace of mind going, well, she's not drinking, but she's not dehydrated. And her urine isn't like crazy, crazy concentrated. So her kidneys must be functioning. She'll drink it as mud puddles, but very little won't drink. Yeah, I just think some, I do know dogs that don't drink very much, but just if you're worried, just do some blood work and do some urine, and you'll probably get the peace of mind that her organs are functioning absolutely fine. Thank you very much, with how much she's drinking. Hopefully.
Thanks, Julie. Lily, she has a caring terrier, age 10, and she had high liver enzymes in May. ALK was 626. Then in October, ALK was 870. She's on the liver tonic and Turk tail. She's on the ECB's protocol for the years, and they have returned to normal. What else can I do to support her liver, and what probiotics should I put her on next? What will help bring down the liver enzymes? What do you recommend? What are your thoughts on liver tonic, Turk tail, juniper, gimel, NAC, and acetylcysteine, melatonin, and SEMI? Should I be giving all these supplements?
That's a lot.
Yes.
And the only reason that I'm saying is that it's, oh my God, why does it keep going away?
Sorry, because I'm answering the
Sorry.
question. The other one,
Sorry, I'm looking at, so it was 626.
there's she's
When,
saying something else. Sorry, but
oh,
yeah,
okay, sorry.
yeah, her right anal gland had some blood coming out a few days ago. I started with belladonna for the first day. I'm on day 4 of giving her your go-to, Silesia 30C and Hepar
So,
South 200C 3 times a day and warm compress, and they are improving. I'm feeding freeze-dried dried chicken necks and beef trasho. I don't know. Is there anything else I should be doing?
No, you're doing a really good job for that, for sure. But you know, saying that her anal gland is affecting her and bothering her, and that I would be really I'm just looking at what you're giving her up here. I don't see a lot of she's on the yeasty beast protocol. Now that she's not on now that her ears are better, I think I would take her probably off of the yeasty beast and start doing probably the wolf with her, and then alternating it with gut soothe. So I would do gut soothe and the wolf, and you could do like 2 days, one day on, one day gut soothe, one day wolf, or 1 week gut soothe, 1 week wolf. I would definitely be putting her on phytosynergy, and you know, melatonin, SAMe, NAC, N-acetylcysteine, they're all really good. I just wouldn't, I don't, if she's been on all that and her liver enzymes are going higher, I think my thoughts would be to take one thing out at a time, maybe. Like I don't know whether I would be giving her, I'm not positive that I would be giving her melatonin. That's the one that's, and the juniper. Those are the two that are sort of jumping out with me to go be careful with all of that. And I don't know what you're feeding her as far as what kind of meat you're feeding her. Is it really clean meat? Is it like is it grass fed in comparison to grain fed? If you can get grass fed meats, that really helps the liver, support the liver big time. I don't know how often you're giving liver tonic, but you can give liver tonic with high enzymes like this 4 times a day. And you know, so really clean food as much as you can. Increase her liver tonic to 3 to 4 times a day. Put her on the wolf strain and gut soothe alternating. And like I said, phytosynergy to try to help with oxidative stress, and maybe decrease some of those supplements for a little bit and then retest her blood and see, and try to make sure that her food, whatever you're giving her in her food, is as clean as possible, like organic, or you know, totally like spray-free vegetables. And you know, because glyphosates, if she's eating some kind of food that has, you know, a high amount of glyphosates, or has been grown in a high amount of glyphosates, then you're kind of defeating the purpose of giving her all of the supplements, right? So I would be very conscious of what she's eating and what you're feeding her, to be sure that it's as clean as you possibly can make it. But like SAMe is good. Yeah, I would just add those supplements, and definitely add the probiotics to get her gut health maybe a little bit more primed.
Great,
Because
oh, sorry.
you know, no, it's fine, but our first mode of defense before, like, as a detox, people think it's the liver. It isn't, it's the gut. Well, first of all, it's the skin. And then the second thing is the gut. And if the gut and the liver, the gut and the skin are at their prime of detoxification, it gives a lot of reprieve to the liver to try and heal, because the liver can heal. So making sure that the gut is at its optimum to detox, and skin is that you're not like putting a lot of stuff on her skin, on this dog's skin. Because if you're putting a lot of stuff on the skin, that can really affect the liver. You're kind of just keep circling around. She had allergies to pig and just took her off of it. She only had been on liver and turkey. Okay. I do put lavender essential oil daily, 1-3 drop. I'd stop that. I would definitely stop that for now, because we have to be really careful. Like lavender is beautiful and it's amazing, but essential oils can be quite hardcore on animals. Their sense of smell is so profoundly bigger than ours. And we just want to keep the skin working to its optimum to try to help the body continue to detox.
Okay.
Is ground bone.
Peter, yes. Is ground bone in food completely safe for dogs?
It should be. It should be completely safe, meaning like if it's really, 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 really ground, like finely ground. You have to be careful if it's ground bone and they're putting it through a big grinder with big holes, then you can get really fat, shard, super sharp hunks of bone, and then that's not safe. That's definitely not safe. So make sure that the food that you're feeding that does have ground bone in it is grounded down to like a almost like a coarse powder. The only other time that ground bone isn't great for dogs and for cats is if there's too much calcium in it and you're feeding too much, it can really, really constipate them. So it depends on how much bone is in it.
Great, thank you. Beverly, help needed for my 11-year-old cat, Jinx. I'm letting his hair grow out so he has more hairballs and is more constipated. He gets healthy gut every day in Felix Flora once a week. He's a very, very picky eater. If I add anything he doesn't like the smell of, he won't eat at all. He's very thin and I am at a loss what else to give him to help him be regular. Maybe liver tonic.
I'm letting his hair grow out so he has more, now he's having some more fur balls and is more constipated. Is he really over grooming? Like, is he really, really over grooming, like really licking? Can you put that maybe in the chat if he's over grooming or licking? Because I don't know when letting his hair grow out.
Not over grooming, but I don't see him a lot of the day.
Okay. And when you say you're letting it grow out, were you clipping his hair? Or had he lost his hair?
He used it to get groomed in a tiger cut.
Oh, okay. Huh. Was he healthier? Like, I mean, I would agree with you. I would let my cat have hair. Can you tell me why he used to get the tiger cut? Was it because of fur balls and over grooming and all that stuff? Just to even it out. Well, sometimes what can happen is if you are grooming a cat and clipping a cat, their body isn't used to having the fur, right? So then their acidity in their gut and their digestibility, their way their gut digests, it's foreign to them to have as much hair in their gut as that they maybe have when they have regular hair. There's a couple things that you can do. You can you know what? I don't know if I would do that. I would give him, truthfully, I would give him oil. I know he sounds picky, but he might do okay on the potency. And potency can help just the lubrication alone, just having an oil in the body for constipation and for fur balls. That's what I would try. Now, you said that you're giving him healthy gut every day. You know what else I would try? I would try Gut Soothe, the feline Gut Soothe, because and he won't eat his I tried potency or hemp oil and he won't eat his food. Okay, then I would try Gut Soothe, because Gut Soothe, he won't eat feline Gut Soothe. Wow. Okay. What about sardines? Would he eat sardines? Stuff like that? I'm just trying to think of slipperiness and helping with the ability of getting oils into his body to help with the not to fish. Tuna was a no-go. Huh? He really is picky. You know what? I hate to say this, but if he keeps getting constipated and he keeps getting sicker, you might have to go back to grooming him. His body might just need like psyllium, that's good for constipation. It's sometimes not great for fur balls though. So I would try to, that's what I'm thinking now. I was told maybe slippery elm. Well, that's Beverly. That's why I said Gut Soothe, because slippery elm would help. And it's got Gut Soothe in it, but I bet you he won't eat he won't eat slippery elm on his own, because it's not the nicest tasting stuff. But you could try, be really careful though, because all those suggestions are good, like psyllium and stuff are really really good. The only concern that I have for that is go super slow, like tiny little bits, because what you don't want to do is have it like get an impaction, because all of those things are supposed to bulk stuff up, and you just want to make sure that you're not giving too much all at once, and then he gets like super constipated. He has to go in and be disimpacted. That would not be good. Big drinker.
Great.
Okay.
Okay, next. Ray is asking, how young is too young to start giving digestive enzymes? I have a 16-month-old dog that is showing signs of acid reflux. My 11-and-a-half-year-old dog has always had severe acid reflux, and the only thing that helps with is daily use of digestive enzymes. I would like to see if they will help my younger dog too, but I don't want to do anything that will affect her digestive capabilities long term. Like we're giving them so young to control acid reflux, cause her body to not produce as much naturally as, and then it stops. But I guess it's just like if he's too young, right, to have it.
Well, 16 months, they can have digestive enzymes at 16 months. Saying that, 16, it's so interesting that they both have it. Both dogs have it. So my first question would be, what are you feeding them? Are they eating the same thing? How often do you feed them? Like, do you feed them a couple times a day, once a day, just in the morning, just at night? Is the is the acid reflux, does your dog have too much space in between eating? I would, before I tried digestive enzyme for acid reflux, I would actually try one of two things. I would try Gut Soothe first to decrease the inflammation in the esophagus. And then I would also try Soil and Sea, because SIBO, I would even try it with your other dog too. Acid reflux is a very, very big symptom for SIBO, which is small intestinal bacteria overgrowth. And the Soil and Sea is really, really helpful for that. And I would maybe try that before I would go the digestive enzyme route, because you don't want to give her extra digestive enzymes if she doesn't need them. Saying that, until we can get food that has like a whole prey, like chopped up rabbit from ears to tail, we're definitely our animal's food, even if it's raw, is depleted in digestive enzymes. So I wouldn't get too scared about that. I think most animals need digestive enzymes.
Great, thank you, Julie. Amanda's asking, what are your recommendations for my 9-year-old GSD, leaky anal glands, cataracts, and joint health?
What are your recommendations for my 9-year-old German Shepherd with leaky anal glands and cataracts and joint health? Well, that's interesting. Diet, a really, really, really well-balanced raw food diet would be a big one. Leaky anal glands. Two things can be happening with leaky anal glands and cataracts, and that's the aging process, right? So, if an anal gland is leaking, sphincter muscles on everything can get weaker. So is it leaking because of that, or are they leaking because they're enlarged and they're not disimpacting properly daily when she defecates? So what do her poops look like? Adding a bit more bone to her diet is adding a bit more bone to her diet can often help with the anal glands. Adding bone to the diet, especially bone that's got cartilage in it, is very helpful for joint. But for a 9-year-old with that, I would recommend Jump for Joints or Jump for Joints for her joint health. I would recommend for anal glands, I would recommend trying to add a little bit more bone into the diet and see if that helps. And then cataracts, phytosynergy. So phytosynergy, Jump for Joints, and probably phytosflora and a little bit more bone. Those would be the things that I would try. Bone broth is really good. Collagen's really good.
Thanks. Taya is saying that she has a 10-year-old Maine Coon male that's been diagnosed with metastasis lymph node carcinoma today. I'm sorry to hear about that, Taya. What did you suggest to help him fight this while we wait for a diagnosis as to where the cancer is originating from?
Hi, is he eating okay? Is he acting okay? I wonder if she can put that in somewhere if he's eating normally. So if he's eating normally, I would be using Phytosynergy 1,000,000%, and turkey tail 1,000,000%, or chaga, or alternating chaga with turkey tail for sure. And I would be giving him Felix Flora.
I think she said that the cat is eating well. Yeah.
Oh, good. Okay. Well, if she's how
How
often?
often in the
Okay,
dosage?
so
Yeah.
Phyto start slow. So once a day Phytosflora, once a day turkey tail, and oh yeah, once a day turkey tail, once a day Phytosynergy, and once a day Felix Flora. And then a week later, if you can, if he's eating it all fine, then I would go up to twice a day with Phytosynergy, twice a day with turkey tail. And if he's still fine, a week later, I would give Phytosynergy 3 times a day, and I would give the turkey tail, Phytosynergy and turkey tail 3 times a day. That's what I would do for now. until you, and then what I would do is when you find out, or even before you find out, depending on whether you want to go the conventional route or you want to go a more holistic route, I would recommend giving Andrea a call. 100%.
Thanks, Julie. Noor, I'm sorry if I'm not reading your name correctly. Is asking what's best item cat who depressed and lonely after cat death? Who
What is
depressed and
cat who's depressed and lonely? Oh. All right. Well, depressed and lonely, I would I would go get a homeopathic remedy called Natmure. It's a really, really good cat remedy, and it's specifically for depression and sadness, especially if something dies or leaves or homesickness, things like that. The wanting to make sure, things like our go-to with aconite, it can help too with the depression, and just lots and lots of attention, paying attention to him, making sure that, sometimes my cat lost his mother and his brother really, really close together, like a month apart. And he would go and hide and sleep in my closet. And for a while I just left him, and I treated him and stuff. And then I just started bringing him out. I just would go upstairs, and if I was working on the computer or watching a documentary or reading, something like that, I would go and kind of force him just to come out and hang out with me. And I talked to him a lot, and he's sad. It's really normal. But you want to make sure he doesn't get sick. So I would do an mirror, and if he's eating well and everything, I would, it sure doesn't hurt to put some phytosynergy or some Felix Flora or something into his food, just to be sure that his depression doesn't bring down his immune system, because it can.
yeah, saying that it plays with him a lot and he keeps meowing and crying.
Aw.
Poor little thing.
Where does it say that?
Here in the chat.
In the chat, play with him. All right, and he keeps meowing and crying.
Yeah.
Yeah, honestly, try Natmure. Go and get 200C Natmure and give it to him twice a day for 3 days and see what happens.
Okay, hi Julie. I have a 14-year-old diabetic cat that suffers from constipation. He's on very little insulin, 1/5 of 1 unit once a day. Can I give him feline gut soothe without any extreme reactions, low blood sugar in particular?
So I have a 14-year-old diabetic cat that suffers from constipation. He's on very little insulin once a day. Can I give him feline gut soothe without any extreme reactions, low blood sugar in particular? Yes, you shouldn't. I mean, we can never guarantee anything, especially with diabetes. There's so many causations from diet with diabetes, like just tons and tons and tons. If you're concerned, you could do, instead of doing feline gut soothe, you could do just even Felix Flora and see if that is helpful first. And all you have to do is start low. Start with like a quarter of a dose, and then see how he does, and move up. But there's lots of cats that have diabetes that are on feline gut soothe, tons.
Great, thanks. Jay is asking, what do you recommend for vitamin D?
Oh, food. Raw food diet. Just species specific diet, and a really, really healthy gut, because a healthy gut is what synthesizes every vitamin. Vitamin D with animals, they get it differently than people do. So I would just say making sure that they have amino acids, making sure that they have a really, species specific diet, and making sure that their guts are really, really healthy as healthy as you possibly can, so that the postbiotic effects, and you're using species oriented probiotics, because the postbiotic effects is the short chain fatty acids and the conversions and the taking the food and creating the vitamins, actually synthesizing the vitamins. Henry, come here.
Thanks. Jeannie is asking, I am concerned about vitamin A toxicity from an overuse of dehydrated beef liver treats. I have been using them quite extensively in training my dog. In addition, I feed organ meat, liver, heart, etc. with her raw food diet. How much is too much? I have ordered gut soothe, I guess, hoping that might have any damage done.
Why are you concerned that I'm just wondering why oh, is it possible to overload liver causing too much? Is it possible to overload liver causing too much vitamin D? Well,
Oh, I guess because she said vitamin A here and then too much vitamin D. So vitamin D. So I'm a little confused now.
well, you know what? My come here. Okay. Do you need to go outside? I might have to let him out. Sorry. My whole thing is balance. So if an animal's going to eat an animal, then the liver is not going to be 3/4 of that animal's body. Guys, hold on 1 second. Do you need to go outside? Do you have to go outside? He just wants me to give him his treats. Sorry. Stop here.
He heard the word treat and then
Oh, I think that's what it is. He heard you say, he heard the word, and now he's like, okay, I know what that word is. Thank you, guy. So yes, you can give too much of one organ. If that's the question, the answer is yes. You definitely can. If you're feeding too much liver, Henry, stop it. Too much liver in comparison to the rest of the organs and the rest of the muscle meats and stuff, you can give them too much for sure. So I would get different TREATSs. So Henry, so that there's, you can get lung, you can get liver, you can get tripe, you can get different kinds, you can even get dehydrated organic yams and stuff like that. Like get different kinds of treats that are that so you're not just doing one, right? That's what I would do. I wouldn't be okay. Now I want to see Henry. There he is right there. Henry. Henry, what are you doing? Say hello. Okay, so that's what I would do.
Okay. Shanna from Edmonton, her 7-year-old Bernice Dexter has histiocytic sarcoma in the lungs, and I am just wondering if I should be giving my 110 lb Bernice a higher than recommended dosage of the chaga and turkey tail. I have been giving this supplement since he was diagnosed in the summer, and he is still doing great, but not sure if I should be giving more.
You can. Our mushrooms are, because they're wild crafted and they're from the forest, and the way they're extracted, it's not gonna hurt. Like Henry, we had a really big scare with Henry do you remember what month that was? Was that April? I think it was
I think
April. So
June or July, I guess.
I can't remember when it was, but he's been on 2 full dropperfuls of turkey tail 3 times a day since that, every single solitary day. So you don't have to worry about that. That's for sure. Should I be alternating? I can give them both twice a day. I alternate. If I alternate between, he gets turkey tail 3 times a day, but every second day I add chaga. That's what I do with him.
Okay, great. Cheryl is asking, my male Shih Tzu is 21 months old and has had all of his vaccines as a puppy, and he didn't tolerate them at all. I recently received the Rebalance and gave it to him for 10 days, 2 sprays a day. How will I know if this has worked? He will not be getting any more vaccines.
Well, you won't know 100% other than if he's acting normal. If there's no has had all of his vaccines as a puppy and he didn't tolerate them at all. I recently received Rebalancer and gave it to him for 10 days. Yeah. So what you couldn't do if he really was having a terrible reaction, do it the 10 days like you did. That's awesome. And then in 3 months, do it again. Repeat it again in 3 months. And you can do that for a year. So you can repeat that every 3 months for like 3, 6, 9, for three intervals throughout the year.
Okay, great. Shelly is asking, neutered male cat had urinary catheter surgery a month ago. He remains peeing small amounts and at times straining, growling, and hissing. How long does recovery usually take? Had X-ray a few days ago, no visible stones or crystals. Someone suggested that rescue animals tend to be neutered too young, and this can contribute to it. I was
Yep.
not having any success with
You can
buprenorphine,
yeah.
prazosin, and gabapentin controlling his discomfort. So I have started a new protocol of CBD, marshmallow, and valerian root. Not sure of amounts and whether there are other things I could be doing. Have put
Yeah.
him onto a wet food diet, as I learned he doesn't drink a lot of water.
So you're right. Neutering them young can cause the urethra to be smaller. And then once you stick a catheter up that urethra, you run the risk of scarring the urethra. And then when the urethra gets scarred, then the passage is even smaller than how small it was prior to. In this cat's case, I would put him on the easy peasy protocol for sure. And I would also I put him on the easy peasy protocol. I would put him on go to, and I would put him on gut seal because of that. When we talk about scarring. So gut seal, easy peasy protocol, and go to. That's what I would do. Because what you want to do is you want to decrease the inflammation in the urethra, bladder walls, any kind of mucosal lining. You want to bring down scar tissue. You want to try to reduce the scar tissue, keep things really smooth and slippery, and make sure that the pH is normal, and try your best to prevent more crystals.
Great, thanks, Julie. Lots of questions
I know.
about cats. No, about cats. I'm surprised.
Yeah, no.
Liza is asking, my 2 Himalayan cats did a wellness checkup yesterday, and my male cat blood pressure was 160 and my female was 190. But we are waiting on their blood work results. They are both 12 years old, but my female cat, we think, might be her thyroid, because she wakes up meowing early morning and she's a finicky eater. I have tried raw food. She won't eat raw. She's super picky. My veterinarian wants to give my female cat blood pressure medication, but I want him to check her pressure again just to make sure.
I'm just reading this.
Mm-hmm.
Mm. When you check blood pressure with cats, it's really, really dicey. It's really dicey to make sure that you're getting a proper reading. Because if the cats are stressed, you're not gonna get a proper reading. I don't know if this is even with the amount of shortages in vets. I don't know if this is even possible, but if there's any way you could get a vet or a technician to come to your house and do the blood pressure check at your house, that's really, really helpful. Like super helpful. Thyroid can increase, so can kidneys increase blood pressure. But going in again and rechecking it and making sure that for sure it is that is really, it's so interesting. It's just because of 116 was 190. That's interesting. I'm just wondering if they were super stressed when they went in, because that will cause high blood pressure. But the crying, meowing, wakes up meowing in the morning, and she's a finicky eater, that can be thyroid, can also be kidneys, and it can also be high blood pressure. Can be all three. So I would definitely wait for the the blood results to come in, and then I would recheck both of them. And I would leave them in the car until they're ready to check their blood pressure. And then I would not bring them in and wait in the waiting room before you have their blood pressure checked. So go in and say, can I wait in the car until the vet is ready to check the blood pressure so that the cats aren't stressed, so that we can get a better and a better accurate reading.
Great, thanks, Julie. Guys, unfortunately, it's getting late, and I know that we have like a lot of other questions here, and I'm so sorry we couldn't answer them all. But I really want to ask you all to join our community on Facebook and ask your questions there. The name of the community is the Adorbis Collective. So you can post your questions there, and we'll be glad to help you with everything. Sorry, do you want to say anything, Julie?
Well, yeah, I was looking down. There is a ton of stuff.
Yeah.
Cat. There are so many cat questions tonight. It's crazy. And then I saw someone over here
I'm
ask
very
about
surprised about that too.
whether we would ever do one just for cats. And we have before.
Yeah,
We definitely have before.
we did one last year, I guess in October. But yeah, maybe we can try to do another one. Yeah, I think it would be great since we have like so many questions about cats.
Yeah.
Okay, amazing. So yeah, I would like, yeah, go ahead. Go ahead, sorry.
So many questions still. Oh my God. Look at them all.
Yeah, I
Oh my,
know. Lots of them, I know.
there is. All right. Well,
Yeah, well, that's it.
we have to try to figure out a way of getting some of them answered. I don't know. I don't know whether we do.
Yeah,
Like
we can
two a
discuss
month. I
that.
don't know.
Yeah, for
I think we
sure.
should start thinking about it, because there's a lot of questions here, like a ton still that haven't been answered. And maybe that's because we haven't really done a lot of a lot of regular Ask Me Anything.
Yeah,
We've
the
been doing
last one was a dental one, so
that,
maybe
and I
that's,
think we
yeah, people were,
was so yeah, let's have a meeting. I say this almost after every single one,
yes.
but this one's even crazier. So
I will
we were
include in the agenda for our next meeting for
okay,
sure.
perfect. Thank you.
So for now, I would like to thank you, everyone who joined us today, and of course you, Julie, for this amazing discussion. And I wish you all a great night. Don't forget to subscribe to our newsletter. You can sign up on our website to get all the information about Outdoor Bees, our promos, new blog postings, and future Ask Julie Anything sessions. Again, thank you so much, everyone. I wish you all a good night and an amazing 2024. I don't know if you want to say.
Yeah,
Uh,
thank you. I'm yeah. No, I'm a little preoccupied at the moment because he's barking at me and I have to go to the barn still. So it's like,
okay, go. Go. I'll
thank
let you
you.
go now.
All right. Thanks,
Thank you,
everybody.
everyone.
Okay, bye.
Bye.